So thank you for joining us. Since March, the elected leaders of the 8 most populous jurisdictions in Maryland have met at least weekly to share our challenges and our strategy in the battle against COVID-19. So we gather each week to share what we hear from our health officers, our hospitals, our residents, and our businesses, and we often invite experts in to advise us. We represent 75% of the state's population. We are geographically contiguous, and early in the pandemic, we represented 90% of the positive cases. Today, we are, in alphabetical order, County Executive Angela Alsobrooks of Prince George's County, County Executive Calvin Ball of Howard County, County Executive Marc Elrich of Montgomery County, County Executive Jan Gardner of Frederick County, County Executive Barry Glassman of Harford County, County Executive Johnny Olszewski from Baltimore County, and our newest addition to the group, we heartily welcome and congratulate Mayor Brandon Scott of Baltimore City. So thank you all for being here. I particularly want to thank County Executive Gardner for informally serving as our chair, and for County Executive Ball for stepping in to that role when she is unavailable. I know that I speak for all of us in thanking one another for our commitment to regional collaboration. So we have invited the press to this meeting because we all believe that we're facing a pivotal moment in what we hope will be the final battle against this virus. We will start with a public health overview of this moment by Dr. Tom Inglesby, Director of the Center for Health Security at the Johns Hopkins Bloomberg School of Public Health. And that will be followed by brief statements from Dr. Gail Cunningham, Senior VP of Medical Affairs at St. Joseph Medical Center, and Dr. Fermin Barrueto, Senior VP of Medical Affairs at U of M Upper Chesapeake Health. So we also have available to answer questions at the end, Dr. Peter Hill, Senior VP of Medical Affairs for Johns Hopkins Health System, and Dr. Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement at Johns Hopkins Bloomberg School of Public Health. So each of our county executives will speak in alphabetical order. Welcome all of you. And I'm going to turn it over to you, Roz Hamlett, our PIO, to get us started.
Good afternoon, everybody. I think it's a good idea for me to start with the end in mind. I'm going to take the final question at 2:58 p.m. And because we've got a long list of participants, many of whom have hard stops at 3 p.m., it would be a good idea if everyone is as mindful of the time as we can be. During questions and answers, I'm going to ask media who have questions to use the chat to identify yourself, your organization, and importantly for me, who your question is for. So once you've identified yourself in the chat, please just click the raise hand button to raise your virtual hand. And I'll use that information in the chat to call your name. Once your name is called, you will be granted speaking permissions and will be able to unmute you and you can ask your questions. And finally, the Zoom link will be available afterward, and it will go out with also a readout for everyone. So handing it back to you, Mr. County Executive.
All right, well, I'm handing it over to Dr. Inglesby.
Okay, great. Well, thank you to County Executive Pittman, to the other county executives, to Mayor Scott, and to your teams. Our state is in a dangerous place in this pandemic. We all know that. COVID cases are rising in most states across the country, with more than 200,000 new cases diagnosed a day and more than 2,200 people dying daily. In this last week, COVID was the #1 cause of death in America. There are more than 100,000 people hospitalized across the country with COVID, with most days bringing a new record high in hospitalizations. More than a third of Americans are now living in areas running critically short of ICU beds. News reports from around the country show hospitals being pushed close to or beyond capacity. In many places, healthcare workers are exhausted or overwhelmed, some of whom have become sick or died. in the course of their jobs. The crisis that COVID is creating in our healthcare system is not a theoretical problem. It is happening now in many places. We've done better in Maryland than most states, but this virus is relentless and is now affecting our state in ways we've not experienced earlier in the pandemic. The number of daily new cases in our state is more than double in the earlier surges we experienced, and the number of deaths has been rising in the last month and shows no signs of slowing down. In the last 2 days alone, there have been more than 150 new hospitalizations from COVID in our state, bringing the number of those hospitalized with COVID to the highest daily record yet, higher than even the original April peak. Hospitals in our state have done a great deal to increase their capacity to prepare for the surge that's on us, and healthcare workers are doing heroic work around the state to try to keep up. But all hospitals eventually will have their limits. There are points beyond which the best possible care can no longer be provided. Other states have already reached this point, and we do not want to get there in our state, which is why, in my view, it's critical to slow the spread of this virus down. The light at the end of the tunnel is the likely start of the vaccination program in our state, hopefully this week, but it will take months for substantial numbers of people to get vaccinated and months to have an impact, for the vaccine to have an impact on the rate of spread of this pandemic in our state. So in the meantime, in my view, we all need to do our part to physically distance, to wear masks, to avoid large gatherings, and we need the help and direction of elected officials in our state to temporarily close settings that are most likely to speed up the spread of the virus. And what happens in the next few months is really up to all of us, the people in this state, working together with our elected leaders to lessen the toll of this virus in the time before widespread vaccination helps us to turn the corner. Thank you.
Thank you very much. May I introduce the next speaker, please? Dr. Peter Hill.
Thank you. I echo Dr. Inglesby's comments. I think the fact that the COVID-19 vaccines are indeed likely the light at the end of the tunnel, I think what's important is that we ensure that the tunnel doesn't collapse before we get there. I think it's important to understand that when we, in our health systems, have additional patients, increasing number of COVID patients, that displaces non-COVID care. We have an equal responsibility to care for all of our Marylanders, regardless of what their underlying disease and condition might be. Nationally, there's evidence that during the first surge, a great deal of harm was occurred towards patients who did not have COVID because of delayed care. We want to avoid that as much as possible. And so our health systems are working very hard to do both at the same time, which is quite taxing. So I appreciate the efforts of the mayor and the county executives. Thank you.
Thank you, Dr. Hill. He was the Senior Vice President for Medical Affairs, Johns Hopkins Health System. Next up is Dr. Gail Cunningham, the Senior Vice President for Medical Affairs and the CMO at the University of Maryland St. Joseph Medical Center.
Thank you very much. Thank you to our county executives and to our mayor for inviting us to attend this conference. I want to give a particular shout out to Johnny O, who's been a great partner for St. Joe's and for all the Baltimore County hospitals over the last several months, meeting with us weekly to find out how we can, or how the county can help us and how we can partner with the county. So that's been a great partnership. St. Joe's is a community hospital in Baltimore County with about 230 inpatient beds. We've seen a definite, significant increase in the number of COVID patients that we're treating. We have surpassed the spring numbers by 30 to 40%. We have been laser focused on preparation for this surge and making sure that across our system, we are aware of the supplies that we have and can share with each other, looking at ways that we can move patients across the University of Maryland medical system if we need to, and really partnering together to try to deliver the best care possible during some really difficult times. We are very focused on our staff and trying to support them. They are stretched, and across almost every hospital in our system, we are nearly at capacity. They have really risen to the occasion. They are working extra shifts, putting in long hours to serve our community. But as was mentioned earlier, it's not going to be sustainable over the long haul. So really to assure that we can give excellent care to COVID and non-COVID patients, we need everybody throughout our state to own the responsibilities of protecting each other, of wearing masks, of using hand hygiene, of social distancing, avoiding crowds, avoiding travel. I think if we do that, we will be in a much better position. We're also very excited about the vaccine that we hope will be on our doorstep maybe as early as next Monday. We've done a lot of logistical planning to assure that we can immunize our staff as quickly as possible, and believe that this is going to be a safe and effective way to stop this deadly virus. Thank you.
Thank you, Dr. Cunningham. Up next, we have Dr. Fermin Barrueto, Senior Vice President, Medical Affairs, University of Maryland, Upper Chesapeake Health.
Good afternoon, and thank you for having me here. I'd like to first thank our Harford County Executive, Barry Glassman, for his leadership, support, and resolve through this pandemic. We at Upper Chesapeake Health have also seen an increase in our COVID positivity rate. We nearly doubled our COVID numbers from the early spring already back in mid-November. What we're seeing now is actually an increase in our overall use of critical care beds, which is really stretching our staff. The staffing crisis, which Gail has already mentioned, it has become one of the biggest constraints, largely because of COVID positive team members acquired in the community or COVID exposed, where they have family members who are positive and thus end up requiring to stay at home. Although the time has been decreased from 14 days down to 10 or 7 days, it still has great impact and has affected our operations. It requires constant adaptation to continue to provide the highest quality care for both our COVID and non-COVID patients. And I too am extremely excited and grateful to see vaccine administration start as early as next week to help protect our healthcare workers and community. Thank you.
Thank you very much. And finally, in this section, we have Dr. Josh Sharfstein, who's the Vice Dean for Public Health Practice and Community Engagement.
Thank you so much. I don't have much to add, but I will say that there's been a tendency with this pandemic around the world and in the country for people to think that what's happening elsewhere can't happen here. And I just really appreciate this gathering and the county executives and the mayor really knowing that what is happening elsewhere could happen here. And that's why it's important to take action now.
Thank you very much. Next, we're going to have a public health overview on COVID-19 from Dr. Tom Inglesby.
That was what I presented a bit earlier.
Yeah.
Maybe
Yeah.
we're
Oh,
out
I'm
of order.
sorry. I'm sorry.
No
Okay,
worries.
very good. On this next section, everybody's presented their on-the-ground concerns and observations, correct? So now we're going to move into the comments from our county executives, beginning with Prince George's County, Angela Alsobrooks.
All right, good afternoon. First of all, I just want to say thank you so much to all of my colleagues. It's so great to see your faces. We've been talking, as you've heard, over the last 9 months. We have maintained communication with each other at least weekly, and in the beginning of the pandemic, we spoke daily. And so I want to say to everyone gathered just how grateful I am for the tremendous leadership that has occurred in our state. It's been just amazing to work with each of you. I want to thank the doctors who are on the call today, as well as the other professionals. I think what is abundantly clear, and I'll make my comments to all of us, and I know that we each agree with this, is we are hearing that we are in an escalating crisis. We're hearing that the numbers are increasing. But the thing that we have never lost sight of for a single moment is the numbers we're talking about are actually people we love. We're not talking about some distant statistic. These are our colleagues. These are our family members. These are our friends. These are our neighbors. And so this has been for all of us a deeply personal sort of crisis. And we have managed it together as colleagues, because what we know about COVID-19 is that it is indiscriminate. It doesn't recognize borders. It doesn't care whether it lands in Baltimore City or county. It doesn't care whether it lands in Prince George's County. It doesn't care your race, your creed, your wealth. COVID-19 is indiscriminate. And so we have had to work together in a collaborative fashion to do what we're called to do, care for the people we represent. And so I want to thank everyone again for that. Prince George's County is in a really difficult position. We have been in the region, one of the hardest hit jurisdictions in the region. We stand today at over 45,000 positive COVID cases. We are currently in a position where we are over 10% in terms of our positivity rate. We likewise are seeing our numbers, our daily case rate per 100,000 residents is 45. We are now at a 1.9, nearly 2% infection rate. Based on the data that we've received from our health officers, and we have been following the advice very closely of our medical professionals and scientists who are telling us that it is very dangerous for us to gather indoors. That includes gyms, restaurants. It includes all of our indoor gathering spaces. And so we have, because of that advice and because of what we've seen with this virus, we, before Thanksgiving, lowered the capacity for most gatherings in Prince George's County, restaurant capacity, personal services. We had to make those decisions at that point. And we know that these restrictions are difficult. They are not only difficult for our residents, they have been very, very difficult as well for our businesses. And so each of us in our jurisdictions, and I know you will hear from them, have also made adjustments to make sure that we are not only supporting those who are living in our environments and who are making tremendous sacrifices. We want to also acknowledge our frontline workers and essential workers who are really literally risking their lives, but we know as well that our businesses are suffering. And so we have each been able to put together supportive packages. We've dispersed more than $20 million in Prince George's County through our business relief fund. We are still taking applications for grants of up to $25,000 through our restaurant resiliency fund. We are also working through a plan through Employ Prince George's County and Prince George's to relaunch an hourly employee assistance fund to allow $300 gift cards for individuals in our community who are earning $19 or less. We also have the COVID-19 Rapid Reemployment Grant Program to help businesses and to encourage them to hire, because Prince George's County right now stands as the jurisdiction in Maryland that has the highest rate of unemployment in the state. And because of that, we are now distributing $500,000 in grants to businesses who hire Prince George's County residents prior to December 15th. So we are each in our various jurisdictions doing what we can during this crisis. But we're here today because you've heard also from the medical professionals how dire the situation has become. And that we recognize that even with all that we're doing, the virus is still spreading. It is not contained at this point. And we are here because we've had to make tough choices. We recognize that all of our jurisdictions are very different, but we know also that our borders are porous. What we mean by that is that we border Montgomery County and Arundel County. I border Washington, D.C. and Virginia, Howard, Charles counties. All of our borders are porous. And so we are asking all of our residents, especially as we approach the holidays, we are now in a position where we're receiving numbers regarding Thanksgiving, and we haven't finished receiving that. And what we know is that the Thanksgiving holiday demonstrated to us once again what our contact tracing is telling us, which is that those personal gatherings are very, very dangerous. And we are asking all of our residents to continue to work with us. We are urging you to make those responsible decisions about gathering, making sure that we're very careful about not traveling where it's unnecessary. You've heard it already on here, to just do everything we can. We have to work together, again, because coronavirus does not know borders. It is traveling throughout our state. And it is incumbent upon all of us to work together to make sure we stop its spread. So I will stop there so that we can hear from the others, and I would look forward to questions at the appropriate time. Thank you.
Thank you. Up next, we have County Executive Calvin Ball, who's going to brief us on Howard County.
Good afternoon, and thank you all so much for attending. Making the best decisions for our residents is difficult, and I want to acknowledge and thank my fellow county executives and mayor for their partnership and collaboration through this very challenging year. I also want to thank the governor for outlining his administration's vaccine distribution planning efforts and expectations yesterday. And I look forward to continued details in the coming days. Now, Howard County has worked tirelessly over the last 9 months to slow the spread of COVID-19 and keep our residents safe and healthy. And while Maryland has done better than most states, and we have remained below the statewide average of 7.9%, we've nearly doubled our case rate from 15 to more than 30 cases per 100,000 residents this time last month. And although 16 jurisdictions in Maryland have higher case rates than Howard County, with some reaching rates as high as 189 cases per 100,000 residents, our positivity rate has increased from 1.9% in October to 6.2% today. Howard County does have the 5th lowest rate in Maryland, but we will continue to remain vigilant. From the onset of this pandemic, we have been working with our health department and our first responders and continue to be data informed and people driven. We focused on testing, contact tracing, and are at the forefront of using serology and antibody testing to gain a better insight to protect our workers and our residents. And compared to the spring, our testing volume has increased exponentially. Last week alone, we administered more than 15,000 tests, dramatically higher than our original goal of 6,500 tests. And last month, we canceled tournaments, placed social gathering limits, continued our travel limitations, and made it so that those social gathering limits were both on indoor and outdoor events, in addition to the reduction of retail and restaurant capacity implemented around the state. These actions are in tandem with our HOCO RISE grants to businesses and nonprofits, eviction prevention, and our new Stay COVID Safe campaign to remind and emphasize the critical actions each and every one of us can do to protect ourselves, our neighbors, and our loved ones. We've been largely seeing compliance from our residents and businesses. Mask wearing has been widely adopted here in Howard County. The vast majority of our faith services have remained virtual, and our restaurants are not nearly at capacity levels, many of which due to the discretion of owners or individual comfort levels. And with a vaccine on the horizon, there is a light at the end of the tunnel, but not an immediate solution. I'm proud to join my fellow county executives and the mayor to persistently urge our residents, take care of one another, to collaborate with our governor to ensure the best decisions are made for our state, our region, and our individual jurisdictions, and to continue to be hopeful that with an imminent vaccine on the way and our mitigation efforts, we will soon be able to return to a better, more connected future. Thank you.
Thank you very much. Next, we have County Executive Marc Elrich from Montgomery County.
Thank you. I'm very happy to be here, and I'm really proud of this group of executives who've worked together, as Angela said, from the very beginning. We have been focused on this because we all share this common concern for the well-being of our residents and trying to figure out what is the best path forward that ensures the maximum amount of safety for the people we represent. As the largest county in the state with over 1 million residents, as well as the second largest jurisdiction in the DC metropolitan area, we've been happy to work with the leadership throughout the state and the region together. Our county shares a border with Prince George's, Frederick, Carroll, and Howard counties, as well as the District of Columbia, Loudoun, and Fairfax counties in Virginia. Like other jurisdictions, our residents cross borders regularly for work, for school, for recreation, or to visit family and friends. And like our residents, COVID knows no borders. So we've relied on data and science to make difficult decisions. And that's what we've been trying to do from the very beginning. We've put tens of millions of dollars into support for businesses and residents to manage the damage this virus is doing to our communities. We are hopeful that the federal government finally steps up and provides the resources that all of us need. But I know that each of us in our own way has been doing as much as we can to knock down the effects of this virus in our community. And we've put people and their safety first while trying to keep business open so that people stay employed and that there's some sense of normalcy. We have seen these numbers before. We faced numbers like these back in the spring. And back then, the state and the counties largely closed. The actions that the governor took and took earlier than other states led to a marked turnaround and substantial improvement in our numbers. I remember looking at our charts compared to the charts of other states, just being so pleased with the way our curve bent quicker and didn't get as steep as happened elsewhere. Now, despite these restrictions, we are watching our numbers climb precipitously. The positivity rate in Montgomery County is almost twice what it was this summer. And my cases per 100,000 are 6, 7, 8 times as high as they were this summer. While vaccines are on the horizon, we are still managing an environment without them. In the face of rising cases, we cannot wait because the virus won't wait. We need a bridge to safety until vaccines arrive and are widely available. And until they're widespread, the only control over the spread of this virus are our own behaviors. We're it, folks. There's nothing else but what we choose to do or not do that controls the spread of the virus. We saw what worked to reduce the cases in the beginning of the pandemic, and I believe we need to revisit some of those steps now so we can minimize the human toll until the vaccines arrive. I want as many of our fellow Marylanders to be around to see and be at the end of the tunnel as possible. I can see the light. I want everybody who sees the light to be able to get out of this tunnel and into daylight again. So we've concluded we cannot stop now. Today, I sent over to the council new steps in the fight against COVID, which if the council approves, will go into effect next Tuesday at 5 p.m. Basically, we are closing indoor dining, outdoor dining, and carry out and drive-through and delivery will all continue to be allowed. We are limiting capacity in large retail stores to one person per 200 feet and a total limit of 150 persons in a retail establishment. And we're limiting sports, non-professional sports are being limited to non-participants of 10 people indoors. Religious organizations can have up to 25 people without approval outdoors, more if they get approval for the conditions in which they're going to do this. Indoor sports are limited to 10. We're determined to do everything we can do to bend the curve again. We know how to do it. We've done it before. We're going to do it again. And we're going to make sure that as many people get to enjoy the holidays that are pretty much ruined for us this year, they're going to get to enjoy these holidays next year. That's my goal. And I'm really happy to be working with a group of county executives who share this common commitment to the well-being of all our residents. Thank you.
Thank you. We have County Executive Jan Gardner, Frederick County.
Good afternoon, everyone. It's so nice to see all of you. I will say that I have really appreciated the collaboration and the working relationship with all of my peers. I am in my second term as county executive and my fifth term as a local official. And I have to say, this is the most collaboration and strongest working relationship among my peers that I've experienced during all of that time. It's not for the best of reasons, but I think it has been really productive. We've been able to share experiences, to learn from each other, to make better informed decisions. Sometimes we move together, sometimes we move a little bit differently, but it's been really helpful because we're all in this together. Certainly in Frederick County, like in all other counties in Maryland, we have been vigilant in monitoring our health metrics, and we've certainly seen all of them move into the wrong direction. We've seen an increase in case rates, positivity rates, and certainly in hospitalizations. And in fact, the rapid escalation in hospitalizations is of great concern right now. In the last 24 hours in Frederick County, because our numbers are relatively small, I am a smaller population county than the others on this call, we did see our hospitalizations increase in one day by about 25%. And that's a big change. We do have one hospital in Frederick County, Frederick Health Hospital. We have a great partnership with them. There's great communication and collaboration. They're very much committed to taking care of the people in our community and delivering a high quality of care. We've had great collaboration on testing, on acquiring PPE, on managing the outbreaks in our nursing homes, which I think has been very effective. And certainly we'll be working together on the distribution of the vaccine. The second surge of cases, from my perspective, is a bit different than what we experienced in the spring. While we are seeing higher hospitalizations and the number of new cases per day is higher, we are seeing fewer people in the ICU. And we do have some of the advantages of knowing a bit more and being a bit more prepared. We have better testing and more PPE, and there's some better patient treatment out there. So there's some better patient outcomes for many people. But in the spring, the counties to my west, which are largely rural, saw very few cases, had few people in the hospitals. And in this current surge, we're seeing many new cases, actually a higher rate of new cases, positivity rates, and hospitalization in the counties to our west. And that is concerning to me because of how it could impact hospitalizations in Frederick County. So I have talked to my county elected officials to my west in Washington County, and I know they're working hard to encourage their citizens to do their part, to wear their face masks, social distancing, and to practice good hygiene and hand washing. But as others have said, we know the virus has no boundaries. So what happens in our rural jurisdictions does affect what happens in our more suburban and urban jurisdictions. And so the effectiveness of the decisions that we make individually are somewhat diminished by some of that inconsistency across jurisdictional boundaries, which is why regional and statewide consistency is very, very important. So in Frederick County, we did have our meeting of our Board of Health the week before Thanksgiving, and we have already limited gatherings, both indoors and outdoors. We've reduced the capacity of gyms and fitness centers. We've hired additional enforcement staff. We adopted a series of fines to encourage compliance, and a number of other things other decisions we've made over time. So we do want to make decisions to get in front of the surge of hospitalizations to the extent that it's possible, and to the extent that we can be effective in doing that. We do know that personal behavior is important. Certainly Dr. Cunningham spoke to this a little bit at the beginning. The choices people make is very critical to our future. I know we saw a lot of people travel and gather for the Thanksgiving holiday, and we're seeing the outcome of that now. I'm concerned with another upcoming holiday season that we're going to see that again, even though there's a lot of health advisories out there suggesting people should avoid all of these gatherings. I'm trying to really encourage our businesses to reinstitute telework back to the level we had in the spring. I think people have, through the summer, slowly went back to work in the office, even if they weren't required to. And I really want to encourage that telework, so more people are working from home and avoiding in-person meetings and gatherings in the workplace, which we know is a source of spread of the virus in Frederick County. So we're trying to encourage everyone to cooperate, to do their part, to wear their face coverings, to avoid those gatherings, and to practice hand washing. So We are all in this together. I know there's more decisions forthcoming. We are facing that big last final fight against the virus with the vaccine on the horizon, but we know that's going to take months. We are looking forward to vaccinating or beginning the vaccination of some of our healthcare workers as early as next week. So I appreciate the communication, the collaboration with my peers around the state. I do believe it has been unprecedented. It's been positive and productive. And we know that we all rise together and that's what we're really trying to do to protect public health and balance that with economic health and mental health. So thank you.
Thank you, Jan. Next, we're moving to Harford County, County Executive Barry Glassman.
Good afternoon, everybody. It's good to see everyone. You know, every day since the pandemic has started, on my desk, I've got a quote that I look at. It's an old Swedish proverb, I think, that in calm water, every ship has a good captain. But rough waters is a test of true leadership. And it seems like I'm seasick. I've been on rough waters so much over the last 9 months. And Harford County's been, over the summer months since the original pandemic, been fairly blessed in that our numbers remain low during the summer months. However, last month we did see a surge that really doubled a lot of our numbers, although today we've fallen below the state averages per 100,000 and our positivity rate. I have to start off by saying a lot of that is due to our partners in Harford County, Upper Chesapeake Health, and it's good to see Dr. Barrueto here, and his family has a long legacy of service to Harford County, and he's kind of that next generation, and we appreciate that. I would also want to thank my colleagues for their collegiality and sensitivity. You know, being from the smallest of the big 8 counties and being a member of the minority party, they are always sensitive and understand some of the burdens I carry, being separate and apart probably from them. But, you know, I point out, and Angela mentioned this earlier, that in local government, 90% of the time, the issues we deal with are not partisan issues. They don't know affiliation, whether it's a zoning matter or something like that. You know, it really doesn't boil down to if you're a Democrat or a Republican. We know that COVID attacks certain of our communities harder than others. If you're older, comorbidity, whether it's diabetes, high blood pressure, if you're aged in a nursing home, or Hispanic and African-American communities, the numbers are much higher. So we know for a fact that COVID doesn't pay much attention to what kind of registration card you're carrying or where you're from. It attacks all of us. And so my message has been very strong in Harford County and the region is that in particular, we need personal responsibility now more than ever to wear a mask, you know, wash your hands and practice social distancing. You can do so much more than a government program can do if you do it yourself. So that's a message also. I think we're all unified in sharing. We have, like most of my colleagues here, we've expended our CARES funding for Harford County. Approximately 95% of our $45 million has been expended on COVID-related expenses, and the other half to support our restaurants and businesses, which I would say are still struggling. They are appreciative to get a grant, but they are quite honest with you that that grant probably only paid last month's rent and electric bill, that in fact they are still struggling. And so we're cognizant of that. I think it takes everyone to really hang on here at the end to try to get through this, to make sure that we protect our loved ones, our businesses, and keep the state strong. The governor's made us a leader in our response, and I think we're at where we are right now as compared to other states. because of his early leadership and some of the actions that we took. I had to reinstitute some of our pandemic planning from the spring to protect workers, to end outdoor tournaments and sports. And we'll continue to monitor that to make sure that we keep the county safe as we move forward. I do want, as the smallest Big 8 county, I do want to mention our commissioners and other folks in rural Maryland that many of them were blessed during the summer also with lower numbers, but some of them now are dealing with surges that are in fact higher than some of the metropolitan counties. And so we do make sure we need a regional approach. And I think I'd like to speak for them that they'd also, when the governor works with them, that they have a say in what happens in their counties, even though they may be a good bit smaller, that they also have an opportunity to decide their fate and how they conduct their restrictions and so forth. That remember it's a big state, and the smaller counties also have a role in protecting their businesses and their citizens. And we certainly, I know we all respect that and want to work with them. So we're excited to be on the ground floor of the vaccine process. I know we've got a briefing and we've got plans here in Harford County. I'm excited about President-elect Biden's 100 million vaccinations in the first 100 days. And I think counties will be on the ground level of that. We are the folks that are going to have to make that happen. And so we need to get the word out there to make sure everyone realizes the necessity to get this vaccination, because really when it boils down to, we can nibble around with a lot of restrictions, but this vaccine is our true battle, our true method of ending this pandemic. And so we want to make sure the counties have an active role in making sure that the vaccination process is carried out. And I have to throw out to Congress and anyone that's listening that in fact, counties need to have support, financial support, our health departments, our healthcare system. We can't do this vaccination without federal support to make sure our frontline folks are protected and have adequate infrastructure to do it. And so that's a message I know we'll all carry to the congressional delegation. But thank you all for including me and let me have a few moments.
Thank you very much. We are going next to Baltimore County.
Thanks,
County
Roz.
Executive Olszewski.
Thank you, Roz. It is great to be here with some of our state's leading health experts, as well as my fellow county executives, and to give a special welcome and congratulations again to Baltimore's new mayor, Brandon Scott. It has been an absolute pleasure and joy to serve along these outstanding public servants. I commend their leadership. Residents of Maryland are lucky to have these folks in office, and it is a pleasure to serve with all of them. As has been mentioned, it is incredibly encouraging to see the first people in Britain begin to get COVID-19 vaccinations this week. Just yesterday, as been mentioned, Governor Hogan provided an update on state planning to roll out a vaccine in the coming months, and we're beginning to see that there's reason for hope that we'll be able to get through this. But people need to know we're not there yet, and we haven't yet realized that hope. And quite frankly, for county leaders and local officials, the vaccine in some ways makes our job, which is to keep our residents safe, all the more important. And that's because people are tired. They want to return to normal. I know that I do. I know that we all certainly do. And news of this vaccine will no doubt cause some people to want to become complacent. But we need those people to hear loud and clear, because this is no time to become complacent. As has been said by some of our leading health officials, it will be months before most of us can receive this vaccine and see the benefit. So between now and then, the actions we're taking will determine how many people will become sick. It will determine how many people will lose their lives to this virus. In Baltimore County, we've taken action. We've turned our BC stat team into a COVID stat team early in the pandemic. We publish our data on a dashboard so our residents understand the impact of COVID here at home. It's been encouraging that in recent days, looking at that dashboard, we've seen some small declines after a major spike. And we're cautiously optimistic about that current trend, but it just reinforces how we all have to do our part to first get and keep our numbers low. That's why we, like others, have put tens of millions of dollars out into the hands of businesses and other partner organizations. It's why we've created a robust enforcement infrastructure to ensure that our public health measures are in fact followed. And to date, our social distancing task force has conducted more than 7,000 unique inspections where they focus on education and outreach, and then site operators who continually violate the rules, with penalties ranging everything from written warnings to fines, all the way to temporary closures for the worst offenders. We are proud to also meet regularly with our hospital leaders. And I want to again thank Dr. Gail Cunningham at the University of Maryland, St. Joe, who spoke earlier, who has been keeping us regularly updated on the challenges her hospital is facing. Later today, I'll be touring MedStar Franklin Square Medical Center to go personally extend my gratitude to our amazing frontline healthcare workers for everything they are doing in response to this crisis. As has been said, this is a great group of county executives and the mayor. We continue to communicate regularly, just as we're coming together today, to reiterate our shared commitment to keeping Marylanders safe and to continue urging residents to follow the science and the best public health guidance to keep ourselves and our loved ones safe as we approach this holiday season. Hope is on the horizon, but we are not yet out of the woods. This virus continues to ravage every community across Maryland. Right now, we're seeing astronomical case rates from Western Maryland to the Eastern Shore and everywhere in between. So let's all step up and do our part so we can finish this journey, crush this curve, and come out stronger together. Thanks.
Thanks, Jenny O. Finally, we have our new Baltimore City Mayor, Brandon Scott, who's in the who's going to talk to us right before we hand it back to County Executive Stewart Pittman to close us out.
Thank you.
Mayor Scott.
Thank you. Thank you. I'm privileged to be with this group. And welcoming, thank you to all my county executives for welcoming to this group. And I look forward to continuing to work with you every step of the way. And the last few days has been great to work with you. We all know, as has been said by public health professionals and the county executives, that we are still in the midst of COVID-19 pandemic. It is not over by a long shot. And we know that we all are in a very difficult position. We all have to make difficult, unpopular decisions, but know that the decisions that all of us make are going to be guided by science and public health officials. In Baltimore, like the rest of Maryland, our cases have steadily increased for a month and half at a rate surpassing the increasing in testing. We are right now, our test positivity rate, our average number of daily deaths, and the number of hospitalizations are all at their highest levels since last spring. Here in Baltimore City, we have lost 552 Baltimoreans to this virus. These are not just numbers. These are people that won't get to celebrate the holidays with their families, albeit virtually. These are folks who won't get to see the potential, grandparents who won't see their grandchildren grow up. And this raises concerns around how our healthcare system's ability to handle the massive influx of COVID patients as we continue with this fight. As of right now, deaths in our city are up 243% over the previous 4 weeks. Our positivity rate is up 85% over the previous 4 weeks. And based on our current trajectory of cases and hospitalizations, projections show that our hospitals will be overwhelmed if we do not act. And in the absence of action that happened at the state level, like in the beginning of this pandemic, we have to take steps to keep residents safe, and we have done that here in Baltimore. This morning, I announced additional restrictions in Baltimore to slow the spread of the virus because we take this seriously, and my job is to make sure that I am protecting the health and safety of my residents. I understand people are fatigued, I understand that people want to get back to a sense of normalcy, but we also have to understand the urgency of what we are living in. We are also in a time of year where the risks are going to increase. The weather's getting colder, the holidays are coming up, and we cannot let up now. We all need to pull together as a community, as a state, as a region, and recognize that COVID-19 has no borders. That's something that you can see in this work that this group is doing. But we must make the tough sacrifices now. No of the decisions that I make and every county executive make is not going to make everyone happy. Yes, they will be tough, but they are in the best interest of our citizens and our residents, and that's what's most important. We have to act now in order to save lives. As I said earlier, and I will say again, we have done great work, all of us, in making sure that we're supporting our businesses, our workers. We will continue to do that. We look forward to working with the Biden administration in a way that we know they will understand why counties and cities need direct funding so that we can support our workers and our residents in an easy way. But we also know that we must act now to make sure that we are safe. We can and will be working together as we go through with how we get the vaccine out. We all understand this is not an easy job, but our job is to ensure that the health and safety of Marylanders come first. And we all, I have the faith in all of us that we will lead, following the guidance of public health professionals, taking the appropriate actions in our jurisdictions, and most importantly, doing the right thing over the popular one, even if it's something that this is about saving lives here. Thank you.
Thank you very much, Mayor. Before we get to our Q&A, we'll hear once again from our county executive, mine, the Stewart Pittman.
Thanks, Roz. Yeah, I echo what everybody has said about how difficult this has been and how wonderful it's been to have a group of peers to lean on and to consult with. I also want to thank the healthcare professionals, both in our hospitals and our public health folks who keep track of the numbers and keep us informed about what's going on. And that's the part that I really want to focus on. And I think that's why we're here now, is that we had a different situation in the spring when our case rates were going up and our hospitalization rates were going up, which is that there were hospital staff that could be recruited from other jurisdictions that did not yet have COVID surges. And that's very difficult right now to bring in the staff to handle a surge, because every state in the country and the whole country is ablaze with a surge of the pandemic. The other thing that's different right now from in the spring is that our hospitals were largely vacated to deal with the surge that was expected, because we had seen what happened in New York City and Italy and in China, and people feared the worst. Now our hospitals are operating at normal capacity, and we have two wonderful hospitals in our county, Arundel Medical Center and Baltimore Washington Medical Center. And so the plan to deal with the projected surge in hospitalizations is to replace the patients that are in there now with COVID patients. And it was mentioned earlier by one of our hospital folks that this does have an impact. This is not a simple and easy thing to do. It means that people who have surgeries scheduled would have those surgeries canceled. And we hope that there's very little health impact on that, but that's not true. We know that there's a major health impact. So the only way that we can push things down, and we do have projections that I especially want to thank the Hopkins for their hospitalization impact reports that we get every week, that show what the projections are if hospitalizations, if case rates continue as they are with hospitalizations. And we're looking at potentially across the state, 10,000 COVID patients if we don't do anything. And we only have 8,000 beds that are staffed right now in the whole state. So that's a pretty scary thought. And I think that's why all of us are talking about further restrictions and pushing the numbers down. That's the only way that we can prevent that scenario from happening. So I want to congratulate the mayor for what he announced today. I'm going to be making an announcement tomorrow of some further restrictions in Anne Arundel County. And I want to say something as well about statewide action versus local action. This is one of the reasons that we sort of came together in the beginning, is that we were asked to make our own decisions about how quickly we reopened during the roadmap to recovery after the the initial shutdown and the stay-at-home order. And I want to say that yes, I and some of my peers, we pushed the governor because the governor is the leader of the state. But that's the way it's supposed to work. That's not a sign of disrespect. The governor pushes the president, and I'm sure that he'll push the next president. The mayor of Annapolis pushes me. We push the governor if we think that there's additional action that should be taken. And yes, I certainly believe that this should be done statewide because we have one healthcare system in this state. So we could stop this virus in its tracks in Anne Arundel County, but our 2 hospitals would still have the patients coming in from other counties. So it's absolutely essential, I believe, that we continue to talk amongst ourselves, that we continue to talk with the governor. I believe that's going to happen. The governor understands what's at stake here. He's a smart guy, and I suspect that we'll be continuing to talk to him about further actions at the state level. But for now, each of us has to do what we believe has to be done in our counties, and it's a little different in each place. We have different folks that we listen to. We all listen to our health officers. We all listen to our business communities, and we all listen to our hospitals, and we listen to each other. So it's our last battle. We're going to look back, I think, on this time, and we're going to wonder if we did everything that we could to save as many lives as we could. And as Brandon Scott said this morning, it's about saving lives, nothing more, nothing less. There's nothing political about this. This is really about saving lives in our counties. So that's what we're all doing. And thank you all for everything you're doing.
Thank you, Stewart. So we're at 2:59, and I said our last question was going to be taken at 2:58, and we haven't even taken one question yet. So if everybody's okay with extending this, we'll just keep streaming, and you can continue to participate to the degree that your time allows you to do that. Also, I would like to invite folks in the chat to begin to post your questions there. So I have Danielle O from the Capitol with the first question. Danielle, you didn't say to who though.
Oh, I'm sorry. Can you hear me?
Yes.
Okay, so this question is mostly for County Executive Pittman and County Executive Alsobrooks, as I cover both Anne Arundel and Prince George's County for the Bowie Blade. I am curious, you've both spoken about how and all of the health officials and county executives on this call have spoken about how things are so much worse now than they were in the spring. What is the impediment to really strict lockdowns for 2 weeks or however long, like we saw earlier in April and through the spring?
Well, I would just throw out that some of the things that were done in the spring were effective, but that our businesses have learned how to operate safely. We know a lot more. So I think there's a lot of economic activity that can continue that was shut down in the spring because we know more. And that's the main. The other thing is that there, to be honest, is that we actually figured out a way to help these businesses through the Federal CARES Act. And right now, the economic assistance isn't there, so that plays into it. But businesses have learned how to operate safely.
And I would add, that one of the other complications is that through contact tracing, one of the things that we've learned is that, at least in Prince George's, and I'm sure this is true in several other jurisdictions, we're finding that the virus is spreading in households. We're finding that in these gatherings that the primary super spreader has been family gatherings and friends getting together. And so it is a little more difficult to find a way to actually enforce those activities. And so in Prince George's, we have a really robust compliance program that we've actually had since this summer. And we have really done a job of going out and enforcing the restrictions that we have in place. And so that's been one of the challenges, I think, that was different from the spring. In the spring, we were concerned about how it was spread, and now we know for sure. that, for example, in the case of Thanksgiving, we've seen the numbers spike. That's the reason we're very concerned about the Christmas holiday as well, is because it's difficult to discourage people who have been in the house now for 9 months to not go and visit grandma and granddad and to visit family members who they miss. And so this is one of the great challenges we have, but we have to stay the course at this point. Really encourage people to follow our guidance. We've recommended in our county, more than recommended, our health officer now through our executive order, we've said no more than 10 people gathering, and that's in private households, and making sure as well that outdoors 25 people, but that's one of the challenges we've seen.
Thank you. Our next question is from Tim Carney with the Washington Examiner.
Thank you very much. County Executive Alsobrooks, you just mentioned the contact tracing data. So for you, for County Executive Elrich, anybody else, to what extent have we seen the cases popping up in and spreading in schools that are open, such as private schools, or in churches, synagogues, and other houses of worship that are having in-person events?
Well, thank you. So far, we actually have not received a lot of data concerning schools. Most of our schools are in a distance learning posture, even the private schools, and some of them have hybrids, but we have not seen that as a source of tremendous spread. We have seen, however, in some of our religious gatherings, we've seen some spread there. And so one of the additional adjustments I made prior to Thanksgiving was to lower the capacity on those religious gatherings as well, indoor gatherings to 25% to account for that. But that's what we've seen so far in contact tracing, is that we have seen some spread in religious gatherings. I actually met yesterday as well with 95 of the pastors in our county to go over those, I met virtually, to go over those restrictions and make sure everyone understood them.
Thank you. Our next question is from Susan Phillips, who is with area, and she's with WUSA 9, and it's for County Executive Alsobrooks and Elrich.
I'm sorry, I just wanted to let you all know I have to jump off, but I'm really glad to have been here with my county executives, and I still have some of my team on the call. So thank you so much.
Thank you.
If I may also, before the question, appreciate the opportunity to join. If there are any questions, obviously our comms team is happy to follow up, but thanks everybody for the opportunity.
Thank you. Susan, are you still with us?
I think my question, Untitled WUSA 9.
Go ahead and ask your question.
Sure. This is for Elrich and Alsobrooks. I'm wondering, how are your counties approaching concerns that people have with actually taking the vaccine? What kind of education are you going to do to ensure that as many people as possible actually take the doses?
So thank you so much for that. We are actually starting a public information campaign. As you know, communities like mine that have large numbers of communities of color are traditionally very skeptical because of the history that we have seen in the medical profession and with vaccines and concerns that we've had. And so we are starting a public information campaign that will be starting right away. I likewise will be hosting a telephone town hall next week for our residents, and it will include members of the medical community who will give actual information. Thankfully, my chief medical officer is a pediatrician. And you know, pediatricians have dealt quite a lot with vaccines, and so he's very knowledgeable about it, but we'll continue to educate the public about it and share information about its safety and answer any concerns that our residents have. But we are going to do that through multiple platforms, including social media. We'll be doing television, radio, and we're going to be also doing a telephone town hall and hopefully get people more comfortable with any concerns they have.
Thank you. Our next question.
A similar approach in the county. We're going to be doing as much public information as we can. We have large populations which, have historic issues with trusting the government. And so we're going to have to do work to make sure that people feel comfortable and understand this is safe. I'm a big believer in the vaccines myself. I think the fact they've been able to do this as rapidly as they have is a real tribute to the state of science today. And I think we just need to encourage people, because absent the vaccines, we would be in very, very difficult times for a long period of times. So I'm hoping people get the message and are willing to get vaccinated.
Thank you. Let's go across the state a little bit to Steve from the Frederick News Post, who has a question for County Executive Gardner and the other county executives if they'd like to contribute.
Hey all. Hi, County Executive Gardner. I know you haven't taken as much restrictions as some of the other county leaders across the state. I was just wondering if you were to go that direction. I know I've reported earlier in the year you have about $50 million in reserves. I know that's going to hit your bond rating. That's why you have those reserves. But I'd be hard pressed to think of a better time in terms of when to use those. And I'm sure other county leaders, that's why I'm sure other county leaders are wrestling with that decision. So that's kind of just the gist of my question.
Okay, well, thank you, Steve, for that question. I will be having my own press briefing tomorrow at 2 p.m. and I'm sure you will attend that and hear what I have to say at that press briefing. But in terms of money, obviously I'd have to go to the county council to spend any money out of our reserve funds, and we would have to replace that out of next year's budget should we do that. I have identified money to continue our health response, to continue rental assistance, to continue food assistance, to continue to house the homeless in a non-congregate manner after the end of the year when our federal money runs out, because I believe those things are essential to do. And so I did talk to the council about that when we had an update on the use of our coronavirus funds in November. So we are in a need to make sure that we spend money to do things, including distribute the vaccination to people broadly in our community. So that will be a future discussion. Certainly, our business community continues to ask for money. We have just finished a round of restaurant grants, and we will continue to try to support the economic health of our community. But without federal assistance, I think that becomes a challenge for many of us to do and to justify dipping into our reserve funds to do. But again, I think there will be discussions about that.
Thank you. And our final question is from Ovetta Wiggins, Washington Post.
Hi, I just wanted to ask, given that we're talking about doing tougher restrictions, whether there's any discussion about making changes to enforcement, or if you could talk a little bit about how enforcement is going and whether you think that there need to be changes as we move forward.
So we will absolutely continue enforcing. We have had a really robust group of enforcers who have gone out every weekend and throughout the week, and we continue to go out to businesses. We have been out and about, going to private residences where necessary, just making sure that we're doing everything we can to stop the spread of the virus. So you'll see more and more of that. We are getting, of course, people who are calling us from the community who are very concerned about their safety. Everyone has a healthy respect for the virus, as you might imagine, here in Prince George's County. And so we're all working together to make sure that we're doing what we can to keep our loved ones safe and healthy. So we'll continue that enforcement program that I think has really been instrumental to us in helping to contain the virus as much as possible. Even though it's spreading, we know that compliance has really been a critical component to what we're doing. You saw National Harbor, for example, where we closed 2 hotels, also put in place there the the restriction for the curfew for young people at 5 p.m. So we're just doing everything we can to make sure that we keep our residents safe.
Now, I'll say we've had, pretty good luck in the commercial sector. Most of our businesses have been following directions, but we're prepared to enforce. And I think because we went out early and we had a group of, we call them ambassadors, who told businesses this is what you need to do if you're not doing it. It probably helped us get better compliance. And we are going to continue to work on how we deal with the family gatherings or events at people's houses. They're the most difficult because somebody usually has to call it in, and it's always people aren't used to having people knock on the door and say, how many people do you have inside? And you can't have these many people. That is a tough thing to do, but we've done it a couple of times, and we're going to keep doing it because we just can't afford to have these things go on when at the end of the day it jeopardizes everybody's public safety.
And I'm going to head off here, but I thank you all so much for the opportunity, everyone.
Thank you so much. I'm going to hand it back.
Thank you, everybody.
All right, thank you.